This is Dr. Rajput. We are going to talk about thyroid function test today. This is a very common question asked by the residents and the students, that how to make a correct diagnosis by these tests of hypothyroidism and hyperthyroidism, Graves' disease, and Hashimoto thyroiditis. Let's begin. These tests are done to find out the function of thyroid gland and diseases related to it. Thyroid is an endocrine gland. It's located in the front of the neck, right over here under the voice box, and it produces hormones which are essential for metabolism, energy, growth, temperature, and catecholamines. They affect muscles, kidney, heart, and brain. The thyroid gland secretes these hormones 24 hours a day to maintain the function of the body. It is the secretion of these hormones are regulated by the pituitary gland that in turn gives thyroid stimulating hormone. The functions of the thyroid can be abnormal due to congenital, which means that the person is born with, or has a drug effect on thyroid, or the diseases that has destroyed the thyroid tissue or has caused the inflammation, or the autoimmune antibodies that are destroying the thyroid, or simply the iodine deficiency. Now, what are these thyroid function tests? These are T3, T4, TBG, thyroglobulin, antibodies, and RAIU, radioactive iodine uptake test. Now, T3 is found in total T3 and free T3 form and reverse T3 form. The total T4, free T4, and free T4 index. So first, we have to get familiar with these tests. TSH is the thyroid stimulating hormone. It's, as mentioned before, is secreted by pituitary gland. It is a blood test. It is most important and sensitive thyroid function test. The normal value is between 0.3 to 4 mLu per LL. It is secreted when thyroid hormone is low in the blood. This signal is sent to hypothalamus and pituitary. Hypothalamus secretes TRH to stimulate pituitary, which in turn secretes TSH to stimulate thyroid gland to produce more thyroid hormone. This test detects between hypoactive or hyperactive thyroid. It also indicates whether it is primary thyroid problem or secondary, which means not with the thyroid, but it is related with other gland like pituitary or hypothalamus. T3, which is triiodothyronine, is a hormone produced by thyroid follicular cells. It is 10% of the hormone, a small amount, and 3 iodine molecules combines with tyrosine molecule. It is released into blood as free or total. The total form is attached with thyroxine binding globulin and has a major bulk of it. The free form is minuscule, very small. 20% of T3 comes from thyroid, only 20%, while rest of that comes from the other tissues of the body. The normal range of T3 is 0.2 to 0.5 nanogram per deciliter, and total T3 is 100 to 200 nanogram per deciliter. The T3 does not correspond well with early finding of hypothyroidism. It becomes low only when severe hypothyroidism is present, so it can be sometime too late. Therefore, it is not used as a criteria to diagnose hypothyroidism because the quantity is very low, and second, it's produced by the other tissues, and third, it is found only when the disease is severe. Now, reverse T3 is isomer and is not used by tissues and liver. Whenever reverse T3 is high, the person is very sick and the system is shutting down, and it is a multi-system failure. It is characteristic of sick euthyroid syndrome but not in AIDS. The normal adult range is 0.11 to 0.32 nanogram per ml. Next is T4, which is tetraiodothyronine or thyroxine. This is the major thyroid hormone, 90% thyroid hormone. It is present in total and free form like T3, and this total, when it is called total, it means it has combined with thyroxine binding globulin in the blood, and it is only released from the globulin when the tissue needs it. The free T4 is also present, which is available for the tissue immediately. The free T4 is not affected by TBG. It is diagnosed for hypo or hyperactive thyroid. The normal range for total T4 is 4.5 to 12.5 microgram per deciliter, and free T4 is 0.8 to 1.8 nanogram per deciliter. Free T4 index, which is total T4 multiplied by RT3U, raising T3 uptake. The normal FT4 index is 1.0 to 4.3 unit, and it is equal to free T4. So you choose either free T4 or free T4 index. It is indirect measurement of thyroid binding globulin. Raising uptake is inversely proportional to amount of TBG. The higher the RT3U, the lower is TBG, and vice versa. It corrects the high and low values of TBG. Now, there are two globulins, which is TBG and thyroglobulin. We have to understand the difference between the two. Thyroxine binding globulin is a protein in the blood with which thyroid hormones T3 and T4 combines. They bind and make total T3 and total T4. The normal level of TBG is 16 to 34 milligram per liter. Again, you also have to check the reference range of your laboratory in your area, because there is a slight difference between the reference labs in different areas. The normal level of TBG, as mentioned, is 16 to 34 milligram per liter. It is increased with contraceptive pills, pregnancy, acute hepatitis, and estrogens. Therefore, F4 level is increased. TBG decreased level can be due to liver and kidney diseases, acromegaly, glucocorticoid, mineral corticoid, and dilantin. Dilantin is the medication used for seizure or epilepsy. Low TBG means low total T4. Thyroglobulin. This is the protein produced by thyroid follicular cells and deposited in colloid. It contains tyrosine to combine with iodine to form T3 and T4. It is a non-specific test. The normal value is less than 60 picogram per liter. It is increased in thyroid injury, inflammation, and cancer. However, it is a useful marker. Remember this point. It is a very useful marker for recurrent thyroid papillary and follicular cancers. Thyroid antibodies. Next, these are autoimmune antibodies whose they attack thyroid gland and cause Hashmat or Graves' disease. These are anti-thyroglobulin, anti-thyroid peroxidase, also anti-TPO, thyroid stimulating immunoglobulin TSI, and TSH receptor antibody. Next test is radioactive iodine uptake. This test measures the iodine taken up by thyroid gland from blood. It shows thyroid function, especially hyperthyroidism, hyperactive. It is not used for hypothyroidism. Pregnant and nursing women should not take this test.